Welcome to today's video. This module is aimed at non-specialist medical professionals, such as general practitioners, nurses, and community health workers, who are involved in the diagnosis and management of depression. In this lesson, we're going to explore pharmacological treatments for depression, focusing on antidepressants, the medications most commonly used to treat this condition. We'll discuss SSRIs, TCAs, and their role in treatment, along with special considerations when treating specific populations, such as pregnant women, adolescents, and the elderly. We'll also talk about how to manage side effects of these medications to ensure patients stay on track with their treatment. Disclaimer: please note that this content is for educational purposes only. While it provides a broad overview of pharmacological treatment options for depression, each healthcare provider must be aware of and adhere to regional prescription laws and professional guidelines regarding the use of antidepressants in their respective healthcare settings. Let's start with SSRIs. Selective serotonin reuptake inhibitors, SSRIs, are the most widely prescribed class of antidepressants. SSRIs work by increasing the amount of serotonin in the brain, a neurotransmitter that plays a key role in regulating mood. Common SSRIs include fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro. Why are SSRIs so commonly prescribed? For one, they tend to have fewer side effects compared to older antidepressants. SSRIs are usually well tolerated, and they are often the first-line treatment for depression due to their relatively safe profile. People with depression often experience low serotonin levels, and by increasing serotonin, SSRIs can help alleviate symptoms like sadness, anxiety, irritability, and sleep disturbances. However, like all medications, SSRIs come with potential side effects, which we'll discuss in a moment. Despite this, they have proven to be effective in reducing depressive symptoms for many people, helping them return to daily functioning. Next, let's talk about TCAs. Tricyclic antidepressants, TCAs, are an older class of medications that were once widely prescribed for depression. TCAs, such as amitriptyline and nortriptyline, work by increasing the levels of serotonin and norepinephrine in the brain. While they can be effective, TCAs are generally not the first choice for treating depression due to their more significant side effects. Some of the common side effects of TCAs include dry mouth, blurred vision, constipation, and drowsiness. These side effects can be difficult for many individuals to tolerate, making TCAs less appealing compared to SSRIs. In addition, TCAs have a higher overdose risk, which can be dangerous for individuals at risk of self-harm or suicide. Despite these drawbacks, TCAs can still be an option for individuals who do not respond to other medications or who experience chronic pain in addition to depression, as TCAs also help with pain management. Reflection questions. What are some advantages of using SSRIs over TCAs in treating depression? Why might TCAs still be useful in certain cases, despite their potential side effects? Now, let's discuss special considerations when prescribing antidepressants. When treating depression in pregnant women, adolescents, or the elderly, it's important to consider the unique needs of these populations. In pregnant women, depression presents a challenge because some antidepressants may affect fetal development. For example, SSRIs can increase the risk of low birth weight and pulmonary hypertension in newborns. However, untreated depression during pregnancy is also dangerous, as it can lead to poor prenatal care, preterm birth, and adverse health outcomes for both the mother and the baby. When prescribing medication for pregnant women, healthcare providers carefully weigh the risks and benefits of treatment. Psychotherapy, such as CBT, may be considered first, but if medication is necessary, SSRIs like sertraline and fluoxetine are typically favored for their relatively safer profile. Adolescents with depression require a careful approach as well. Teenagers often experience depression differently than adults, with symptoms like irritability, anger, and risk-taking behavior. Adolescents may also have concerns about taking medication due to stigma or a desire for independence. SSRIs are generally considered the safest antidepressants for adolescents, with fluoxetine being the FDA-approved choice. However, healthcare providers must monitor for potential suicidal thoughts, as antidepressants may increase the risk of suicidal behavior in young people, particularly during the initial stages of treatment. The elderly also have unique considerations when it comes to antidepressants. Older adults often have multiple health conditions and may be taking several medications, which increases the risk of drug interactions. Additionally, elderly individuals may be more sensitive to side effects, such as dizziness, sedation, and memory problems. For elderly patients, it's important to start with a lower dose of SSRIs or TCAs and monitor closely for any side effects. Mirtazapine, an atypical antidepressant, is sometimes used in elderly patients as it has a dual benefit of improving appetite and sleep while treating depression. Reflection questions. Why do you think pregnant women with depression require careful consideration when prescribing antidepressants? What are some unique challenges in prescribing antidepressants to adolescents and the elderly? Now let's talk about managing side effects of antidepressants. While antidepressants can be highly effective, they do come with side effects, and managing these side effects is key to ensuring that patients continue with their treatment plan. Common side effects of SSRIs include nausea or upset stomach, especially when first starting the medication. Sexual dysfunction, including decreased libido, difficulty achieving orgasm, or erectile dysfunction. This side effect can be significant for many patients, leading them to stop taking their medication. Weight gain is another concern for long-term SSRI use, although it tends to occur gradually. Managing side effects is an important part of antidepressant treatment. For instance, if sexual dysfunction is a problem, the doctor may adjust the medication dose, switch medications, or add medication to counteract the side effect. Nausea can often be minimized by starting at a lower dose and gradually increasing it, or by taking the medication with food. Weight gain can be addressed with dietary changes and exercise, as well as a discussion about lifestyle habits. Reflection questions. How might managing the side effects of antidepressants improve adherence to treatment? What steps can healthcare providers take to help patients manage common side effects like nausea or sexual dysfunction? In conclusion, antidepressants like SSRIs and TCAs play a central role in treating depression. However, special considerations must be made for pregnant women, adolescents, and the elderly, as each population has unique needs and risks. Additionally, managing the side effects of antidepressants is crucial to ensuring that patients stick to their treatment plan and achieve the best possible outcomes. Disclaimer: as this content is aimed at non-specialist medical professionals, please remember to adhere to regional prescription laws and professional guidelines when prescribing antidepressants and managing depression in these populations. In the next video, we'll take a deeper look at psychosocial interventions like cognitive behavioral therapy, CBT, and interpersonal psychotherapy, IPT, which are powerful tools in treating depression. Let's keep it going, and I'll see you in the next one.